So you've been to the doctor, you think you may need a liposuction, but the surgeon says that a tummy tuck will be better for you. So these are some of the common complaints as a plastic surgeon that I see in my clinic when patients come with a specific procedure in their mind and then they are told that they would need a completely different procedure. So in this video, I want to talk about what are the indications of liposuction and what are the indications of an abdominoplasty or a tummy tuck and what would be the best for you. Hello, my name is Dr. Arjun Handa. I'm a body contouring surgeon at Handa Aesthetics. So let's start with liposuction. So in liposuction, what we essentially do is we make small puncture wounds around 4 to 5 millimeters, and then we melt the fat and then we suck it out. So there are no extensive incisions or extensive maneuvering in this procedure. We may use selective removal of fat to contour your body, but at the end of the day, what we are doing essentially is just removing the fat. So to give consistent and good results, we rely on two factors in liposuction. One is skin elasticity. If the skin is elastic and we know that it's going to contract and shrink predictably, then liposuction is a good choice. The second factor is the tone of the muscles, specifically in the abdomen, if we are doing abdominal liposuction. So if the tone of the abdomen muscles is normal, then we know that after removal of the fat, the patient will not be left with the protruding belly. In case the patient has a loss of tone or there is diastasis recti, that is separation of the connective tissue holding the muscles together, then again liposuction is not a good option because what it will do is going to unmask the bulge caused by the loss of tone in the muscles. And eventually the patient will still have a bulging belly and it's not going to look very good. So for these patients where there is either a loss of elasticity of the skin or the muscle is not normal, an abdominoplasty might be a better option because in an abdominoplasty or a tummy tuck, we are doing liposuction, we are cutting out the excess skin, and we are tightening the abdominal muscles. But remember, there is something called as visceral fat also. So the visceral fat, which is around your organs, that is around the liver, kidney, intestine, and all the deep fat which is present in your body, if it is excessive, then neither liposuction and neither abdominoplasty is a good option. Because even after liposuction, because of the excess visceral fat, you will still look a little bulgy. And even in abdominoplasty, it's not going to help you because your number one, your abdomen is going to look bulging out. The second thing is that in case you decide to lose visceral fat later on and the stomach shrinks, the skin is going to hang and become loose again because it's lost its elasticity. So if you have low visceral fat, some subcutaneous fat, normal skin tone and normal tone of the muscles, then liposuction is good. But in the case you have low visceral fat, but subcutaneous fat, poor tone of the muscles and loss of skin elasticity, then a tummy tuck or abdominoplasty is better.